Malaysia's national budget has always played a crucial role in driving economic growth and ensuring social welfare. Before the COVID-19 pandemic, the budget focused primarily on infrastructure development, economic diversification, fiscal discipline, and social support for low-income groups. The government's approach emphasized long-term growth, fiscal consolidation, and investment in key sectors such as education, healthcare, and tourism. However, the outbreak of COVID-19 in 2020 brought unprecedented challenges, prompting a fundamental shift in budget priorities. The government introduced large-scale stimulus packages to mitigate the economic fallout, support public health, and provide financial relief to businesses and individuals. Post-pandemic budgets have focused on recovery, resilience, and sustainability, with increased spending on healthcare, digitalization, and social assistance. Let's look at the Malaysia Budget 2019. The theme for the Budget 2019 is a resurgent Malaysia, a dynamic economy, a prosperous society. Government better targeting of cash transfers through the new Bantuan Sara Hidap Rakyat (BSH) program to account for household size. And fuel subsidies are also steps in the right direction. The new budget's focus on promoting education, skills, and entrepreneurship is a highly welcome development. The Education Ministry remains the single largest recipient of budget allocation at RM 60.2 billion or 19.1% of the total government expenditure for 2019. First, a total of RM 2.9 billion will be provided to help students from lower income groups in terms of food, textbooks, and cash assistance. Second, the government will allocate RM 652 million for the purposes of maintenance of schools, as compared to RM 615 million allocated in 2018. The government will be allocating nearly RM 29 billion for the Ministry of Health. This includes an allocation of RM 10.8 billion to provide medicine, to upgrade and improve the quality of health services at our clinics and hospitals. The Ministry of Health will pilot a nationwide health screening program, Skim Perlindungan Kesehatan (PIKA), for 800,000 individuals aged 50 and above and B40 households at a cost of RM 100 million. To protect women's health, the government will allocate RM 20 million to provide free mammogram screening, human papillomavirus, HPV vaccinations, as well as Pap smear tests, benefiting up to 70,000 women. The government will also allocate RM 50 million for the specific purpose of treating rare diseases, treating hepatitis C, addressing stunting among children, providing more hemodialysis screening and treatments, and enhanced primary healthcare, NPHC. A total of RM 314.6 billion is budgeted for federal government's expenditure in 2019. RM 259.9 billion will be allocated for OE, a year-on-year increase of 10.4%, with the largest allocation for emoluments, 31.6%, followed by debt service charges, 12.7%. RM 54.7 billion is provided for development expenditure. Next, we look at Malaysia's budget for 2020. Malaysia's Budget 2020 was introduced with the theme driving growth and equitable outcomes towards shared prosperity. COVID-19 pandemic posed significant challenges to Malaysians regarding social welfare, healthcare, and education. In terms of social support, the government introduced various financial aid programs to ease the burden of those affected by job losses and reduced income. These included Bantuan Perayaan Nasional (BPN), one-off financial assistance was provided to the B40 and M40 income groups to help them cope with the pandemic's effects. Gyaran Kas Perayaan (GKP) special financial aid was offered to micro, small, and medium enterprises (SMEs) impacted by the Movement Control Order (MCO). The country's healthcare system was a primary focus during the pandemic. The government allocated additional funds to the health sector to ensure hospitals had adequate capacity and all patients could receive treatment. Health-related assistance included funding for vaccination through the National COVID-19 Immunization Program (PIC). Vaccines were provided free of charge to all Malaysians. Hospital resource expansion funds were allocated to increase the number of ICU beds, medical equipment, and oxygen supplies in public hospitals. The COVID-19 pandemic had a significant impact on the education sector, particularly with the implementation of online learning. The government took various steps to ensure education could continue, including Perantai Siswa program. This initiative provided free laptops to students from low-income families, B40, to help them participate in online classes. Healthcare was a primary focus of the operating expenditure during the pandemic. In response to the pandemic, a significant portion of development expenditure was directed towards strengthening the country's healthcare infrastructure. As the pandemic hit early in 2020, Malaysia's fiscal deficit soared due to the increased spending required to manage the crisis. As a result, Malaysia's fiscal deficit reached 3.2% of GDP in 2020, marking a substantial increase compared to the previous year. Lastly, we're looking for the Malaysia Budget 2022. The theme is a prosperous Malaysian family. The Budget 2022 show that Malaysian government have approved to put several assistance programs across social, education, and health sectors in response to the COVID-19 pandemic. Direct financial aid. The Pemilih Assistance Program includes RM 10 billion in direct financial aid through programs such as Bantuan Perayaan Rakyat and Bantuan Kas COVID-19. This includes a subsidy of up to RM 500 of assistance to low-income families, such as B40 group, and give additional support to the hardcore poor families. Government Malaysia allocate a total amount of RM 50 million for the Member of Parliament to provide food basket assistance to affected households. Beside that, a total of Rm 10 million also be allocated for food basket assistance specifically for indigenous communities. In order to increase the allocation to the education sector, the Malaysian government has agreed to allocate Rm 14.5 billion to the Ministry of Education in the 2022 budget, which is the largest allocation to the ministry. Budget 2022 provide a total Rm 32.4 billion to the Ministry of Health for their operating and development expenditure. As a government that cares about the well-being of its people, the Ministry of Health's allocation is the second largest after the Ministry of Education. The operating expenditure for Budget 2022 was set at Rm 233.5 billion, which constituted approximately 70.3% of the total budget of Rm 332.1 billion, while Rm 75.6 billion for development expenditure. Fiscal deficit for 2022 is projected to shrink to 6% of GDP.
One of the social issues may be the irregularity of the citizen. Because they don't have money, it's not of social issues can rise. One of them may be unemployment. Am I right? Employment?
Yes.
Maybe because they don't have a job, some of them, because some of the companies already closed due to the COVID. So this employee don't have a job. So there's a lot of things can happen. Mental health, right? That
Yes.
will be spending to correct back the mental health. And the unemployment, if the government will spend, maybe the unemployment rate will going to be high. And then maybe on the inequality of the citizen itself in terms of the debt, income gap, especially for the B40. We have to take care of the B40 because there are more B40 compared to M40 and the higher one. So M40, they don't have not enough income, so maybe part of the government spending has to go to the B40, maybe room them to be more business so that they can earn income for their family and also work out the special.
Our Prime Minister to them and our Finance Minister is Ibu Eng. Okay, so at that time, rebranding the what we call dreams. Okay, before this we is as the COVID-19 programs, Bantuan Rakyat Satu Malaysia. So they're changing the branding to Bantuan Sara Hidup (BSH). Okay, so they are rebranding from 1,000 ringgit that the synergy giving. So to I believe in giving the community around 1,000 ringgit for the low income community. Now we call it as P40. Okay, so they get 2,000 one off payment for the government allowance for the P40. Okay, the government can increase the minimum salaries. Okay, minimum salary from 1,050 ringgit to 1,100 ringgit. Okay, before this, the B40 complains about their salaries. So government try to increase, introduce the new policy that 1,100 for the minimum salaries during the time. So in one end, as a finance minister, so they are implement e-wallets. Okay, so to encourage P40 to involve the e-wallets, so they are giving 500 ringgit who are registered in any e-wallet program, such as that time Hashengo, 50 ringgit registered. So that's mean P40, M40, P20 or student who are registered to get the 50 ringgit. And so that encourage B40 or low income community to join. B40 they are scared about scammers, securities, everything. So when the government giving that kind of program, so that involve that low income community to join the e-wallet programs.
As a conclusion, the COVID-19 pandemic marked a turning point for Malaysia's fiscal strategies, shifting the focus from long-term growth and infrastructure development to immediate public health and economic recovery. Pre-COVID budgets emphasized economic expansion, fiscal discipline, and social support, reflecting a stable and forward-looking fiscal policy.